Did you know that the first recorded use of emetics, substances that induce vomiting, dates back to ancient Egypt? That's right. These intriguing concoctions have been around for centuries, used by ancient healers to purge the body of what they believed were bad humors or harmful toxins. Imagine the surprise of those early practitioners using what they had at hand to combat illness. Now, let's take a closer look at the journey of these fascinating substances. Emetics have been used for thousands of years, but the science behind them wasn't understood until much later. Indeed, the quest to understand the mechanics of emetics began centuries ago, when these substances were discovered and used for their unique ability to induce vomiting. One such substance that stands out in the annals of pharmacology is ipecacuanha, a plant native to South America. Named after the Tupi words ipe meaning road and ka meaning plant, ipecacuanha was used in traditional medicine to treat various ailments, and it was later recognized for its emetic properties. Now, you may wonder, how does ipecacuanha, or any other emetic for that matter, work? Well, it's all about the brain. When ingested, these substances stimulate what's known as the vomiting center, located in the medulla oblongata, a part of the brain responsible for autonomic functions such as breathing, heart rate, and, of course, vomiting. Emetics trigger this center by irritating the stomach lining, sending a signal to the brain that something is off. The brain then responds by initiating the vomiting reflex. But it's not just about getting rid of the contents of the stomach. Emetics also stimulate the production of saliva, tears, and sweat, and they can even affect the heart rate. These physiological changes are all part of the body's response to what it perceives as a threat, a sort of inbuilt defense mechanism. Now, you might think that the use of emetics would have waned with the advent of modern medicine. However, that's not the case. The understanding of their mechanism allowed for more refined applications in the medical field. For example, in cases of certain poison ingestions, inducing vomiting with an emetic can be a life-saving intervention. However, the use of emetics is now more controlled and is typically administered under medical supervision to ensure safety and effectiveness. With the advent of modern medicine, the use of emetics has become more refined. As we delve deeper into the world of pharmacology, we continue to discover new ways to harness the power of these fascinating substances. As science progressed, researchers began to look for ways to combat nausea and vomiting, leading to the discovery of anti-emetics. The journey of anti-emetics began in the early 20th century, when scientists started to explore substances that could counteract the unpleasant symptoms of motion sickness. One of the first substances to be used for this purpose was scopolamine, a medication derived from plants in the nightshade family. Used in the form of a patch applied behind the ear, scopolamine was found to be effective in preventing the dizziness and nausea associated with sea and air travel. However, the true revolution in the field of antiemetics came in the mid-20th century, with the discovery of a class of drugs known as phenothiazines. Initially developed for their antipsychotic properties, phenothiazines were soon found to have a powerful anti-emetic effect. This discovery was a game-changer, as it opened up new possibilities for the prevention of nausea and vomiting in a variety of clinical settings. Phenothiazines became particularly important in the management of post-operative and chemotherapy-induced vomiting. Before their introduction, nausea and vomiting were often the most dreaded side effects of these treatments, causing significant distress, and sometimes even leading to treatment refusal. With phenothiazines, however, patients could undergo surgery or chemotherapy with significantly less discomfort. This not only improved their quality of life, but also increased their willingness to complete their treatment regimens, thereby improving overall outcomes. Other drugs, such as metoclopramide and ondansetron, were later added to the anti-emetic arsenal, further expanding the possibilities for managing nausea and vomiting in a variety of settings. These developments have had a profound impact on medical practice, making it possible to provide more comfortable and effective care for patients. The development of anti-emetics marked a significant turning point in the treatment of nausea and vomiting. With their discovery, physicians gained a new set of tools to help their patients handle some of the most common and distressing symptoms of illness and treatment. And as we continue to learn more about these drugs, we can look forward to even more effective strategies for managing nausea and vomiting in the future. In today's world, both emetics and anti-emetics have important roles in healthcare. Emetics are primarily used in instances of certain types of poisoning. When someone ingests a harmful substance, inducing vomiting can expel the poison from the body before it's fully absorbed into the bloodstream. However, it's crucial to understand that emetics should not be used in every case of poisoning. For example, in situations where corrosive substances, such as acids or alkalis, are ingested, inducing vomiting can cause further harm. Therefore, the use of emetics should always be under the guidance of a healthcare professional. On the other hand, anti-emetics are widely used in treating nausea and vomiting caused by a myriad of conditions, and their use has only expanded with time. They're frequently prescribed to pregnant women experiencing morning sickness, a common yet often debilitating condition. Anti-emetics like doxylamine and vitamin B6 have proven effective in reducing nausea and vomiting during pregnancy, improving the quality of life for many expectant mothers. In the realm of oncology, chemotherapy often comes with the side effect of severe nausea and vomiting, which can discourage patients from continuing with their treatment. Anti-emetics play a crucial role here, helping patients tolerate their chemotherapy regimens. Drugs like ondansetron, a type of serotonin receptor antagonist, have been a game-changer in this field. They work by blocking the action of serotonin, a chemical in the body that can trigger nausea and vomiting. Surgery is another area where anti-emetics are indispensable. Post-operative nausea and vomiting can be a significant issue for patients, but anti-emetics like metoclopramide and droperidol can help manage these symptoms effectively. These drugs work by blocking dopamine receptors in the brain, which can reduce the feeling of nausea. The development of newer anti-emetics continues, with drugs like aprepitant, a neurokinin receptor antagonist, gaining recognition for their effectiveness. Aprepitant works by blocking the action of substance P, a neurotransmitter in the brain associated with nausea and vomiting. This drug is particularly useful in preventing delayed nausea and vomiting associated with chemotherapy. The journey of emetics and anti-emetics is a testament to the evolution of medicine. As our understanding of the human body and its reactions to various substances improves, so does our ability to manage and treat symptoms like nausea and vomiting. While the use of emetics has seen a decline due to the potential risks associated with them, the use of anti-emetics continues to grow, providing relief to millions of people around the world. In conclusion, the modern use of emetics and anti-emetics serves as a reminder of the balance in medicine. While emetics have their place in specific, controlled situations, anti-emetics have taken center stage in managing and preventing nausea and vomiting in various conditions, improving the quality of life for many. While the use of emetics has declined, the use of anti-emetics continues to grow, helping millions of people around the world. Let's recap the fascinating journey of emetics and anti-emetics. We've traveled through time, exploring the early days of pharmacology, where emetics were used as a therapeutic tool. Emetics, substances that induce vomiting, were widely utilized in ancient civilizations, from the Greeks to the Egyptians. They were used to cleanse the body of perceived harmful substances, a practice that was common in several ancient medical systems. We then discovered the breakthrough that was the birth of anti-emetics. This was a game-changer in the field of pharmacology. Anti-emetics, substances that prevent or alleviate nausea and vomiting, came as a relief to many suffering from conditions that caused these symptoms. The development of anti-emetics started in the early 20th century with the discovery of substances like scopolamine. The journey didn't stop there, though. The evolution of these substances continued, with the advent of more effective and diverse anti-emetics like serotonin receptor antagonists and corticosteroids. These advancements made it possible for patients undergoing treatments such as chemotherapy to experience less nausea and vomiting, improving their quality of life significantly. In the modern era, the use of emetics and anti-emetics has taken on a new dimension. Today, they are not just used in the treatment of conditions causing nausea and vomiting. Emetics are used in cases of poisoning to induce vomiting and expel the harmful substance from the body. Anti-emetics, on the other hand, have found use in a variety of conditions, from motion sickness to post-operative nausea. We've also discussed the side effects and contraindications of these substances. While they have been life-saving in many instances, it's crucial to use them judiciously. Remember, every substance that has the power to heal also has the potential to harm if not used correctly. This journey of emetics and anti-emetics is a perfect illustration of the evolution of pharmacology. It shows us how our understanding and use of substances to heal and manage conditions have evolved over the centuries. It's a testament to human ingenuity and the relentless pursuit of knowledge and better health. Emetics and anti-emetics have come a long way since their ancient origins. They are a testament to the power of scientific discovery and the relentless pursuit of better healthcare. Subscribe for more because you won't find me later.